Community engagement and advocacy. That's what we're going to be studying over the next 10 weeks. My name is Blaine Parrish. I'm an assistant professor in prevention and community health at the George Washington University. So welcome to the course. There are a lot of reasons why I decided to teach this course, and I'm glad that you're going to go down this path with me. So I began my career at a nonprofit organization helping people living with HIV. And after spending some time there, I realized that the important work, the really good work, is at the community level. But the resources that are necessary to make that happen come from the federal government. So I did my stint in federal service working for the Health Resource Services Administration in their HIV/AIDS Bureau. That led me to my current position. I felt so strongly about interventions and what was needed in the community, and knowing that the federal government was there for the money didn't mean that someone was there to help them with the actual ideas. So implementing ideas happen here at GW. So I'm glad you joined me for that. With that as kind of a backdrop of who I am and the work that I've done, I want to take you kind of on a roadmap through what the course is going to look like. There are many exciting and wonderful things that are going to happen. First, we're going to look at bias and our own personal bias when working in a community. After we learn about that and we think about that, we can talk about what communities need. Who influences the community? What kind of influence is important, and how does that make change? Then we're going to look at not only who is in the community, but what's in a community. We're going to talk about asset mapping. What are the assets, and how do those programs help people better their health? Once we have an inventory of all of those people, we're going to put them into what's called a logic model. And that logic model is going to be our roadmap in the community to actually doing the most exciting work, which is interventions. You probably have lots of different interventions you use in your own life. In public health and in communities, those interventions lead to real change. That kind of real change and the things that you'll be doing in the community are important. And it usually comes from a passion that you have. So part of our discussion is going to be about advocacy. Personal advocacy, those things that touch you, those things that motivate you, that's where we're going to start. But then we're going to look at those things in the community. Certainly taking a look back at some of our bad behavior in public health. How have we used this parental model of telling communities what they need? We're going to spend some time talking about how that happened and what we can do to change it. And then finally, once we put all of that together, we're going to talk about what long-term commitment we have in a community and what kind of plan we need to put in place. A communication plan, our advocacy plan, to keep that happening. Communities deserve our support and they deserve our help, and they're more than ready to engage in their own issues and in their own advocacy. So this course will help you make that happen.